Greetings and welcome to another edition of Montpelier Connection. This is actually our wrap-up edition since the 2013 legislature has adjourned. I'm Representative Mike Mawicki from Putney, and I represent the Wyndham 4 district of Putney, Dummerston, and Westminster. Joining me here today is Senator Jeanette White.
Hello.
Welcome.
Thank you.
Well, it has been quite a year. We had a lot to do this year. We started out this year with quite a bit of economic uncertainty. The nation was still kind of struggling with the economy. Vermont was struggling a little bit, even though we are much better off than a lot of other states. As the session moved on, though, I think things started to solidify with the economy, and it feels like we're on the right track now. When we started this session, we were looking at a possible $30 million budget shortfall. By the time we got to the end of the session, we realized that revenues were coming in better than we thought. So we were able to balance the budget, as we always do, but without needing to raise revenues significantly. The only significant place where we did raise revenues was almost a necessary gas tax.
Right.
And part of that was our roads and bridges are in great disrepair. We need to put together a match, and I forget how much it is for the federal match.
I think we would have lost $100 million.
Yeah.
Is what.
And the reason gas revenues are down, there's good news, bad news scenario here. People are driving less. People are driving more efficient cars, and this is all good, especially for those of us who feel that climate change is a real threat to today and the future. So those are good things. The downside of it is our gas revenues are dependent upon how much people drive, so they're down. That's why we raised them almost 6%. But I hope people will see that as they're stuck in construction traffic this year, that money is going to a good cause. In the House, there was a good bit of conversation about that. I don't know how it was in the Senate.
Of course, there was conversation about it. I'm not on the Finance Committee, so or the Transportation Committee, which is where it was raised, and then in the budget. So,
along with that, though, the economy in Vermont seems to be doing pretty well. We have one of the lowest unemployment rates in the nation. We have, I think, the only state last year that registered net income gain. These are all good things. Alongside that, though, the financial reality check is that revenues are only back to where they were in 2008. At the same time, the needs that we're looking at from Vermonters have been increasing right along to 2013 levels. So one of our challenges with the budget was, how do we balance the available revenues we have and all the needs that continue to grow? I think we did a lot of good work in that regard. There were a number of other issues that we were looking at this year, and Jeanette, you were right at the fore with a number of them. And agriculture is dependent upon immigrant labor now. And you introduced the bill, was it 2 years ago?
it was 2 years ago, so it was in the last biennium.
Yeah.
And it was just on a whim. I was listening to VPR one day, and they were talking about undocumented workers and how dairy workers and how people are stuck on farms and can't get off. And I thought, whoa, that doesn't make any sense. We have work visas for seasonal workers who pick our apples and work in the vegetable fields and work at the ski resorts and are visiting professors at UVM, but we don't have any documentation for dairy workers. So I introduced a bill, and it was clear that it was going to be against federal law. So David Hall, who is an amazing, one of our all amazing legislative council people, drafted a bill, and it went forward, and it's a completely different bill than it was, but it passed last year in the form of a study, and this year it passed, and people will now be getting driver's licenses.
Yeah. Well, thank you for your leadership on that. Locally, Molly Burke also did a lot of work in the House side of things.
Right. Well, once you introduce a piece of legislation, it's not yours anymore.
That's right.
So it's all those other people that did a lot of work.
Well, thank you for starting the ball
Both
rolling
transportation
on
committees and the ag committees.
Yep. Mm-hmm. Yep. So a lot of people had questions about that too. I know on the House floor the debate ran the gamut from it's time to welcome. These are the new Americans. It's time to welcome them. On the other side of the floor, there were people who were suggesting these were terrorists and pawns for the drug cartels of Guatemala and Mexico. And there they were, just sitting there, these hard-working dairy workers. And I think once you get to know them, spend some time with them, and hear how hard-working they are, it's clear we need to welcome them and do what we can to help them.
Well,
be
they
part
would.
of this.
It is hard work, and they wouldn't be here if Vermonters wanted to take those jobs.
Right.
But the
And this
dairy
is true
industry
across the
cannot-
country
really, it
for
is.
agriculture.
Right, but here in Vermont,
Yeah.
our dairy farms cannot find people to work on them because it is really hard work.
Yep. It's one of those reality checks, I think, as we looked at looking back on the session. We're now in the 21st century. Some of the attitudes that we have, I think it's time to update them and bring them into this century. And a lot of our laws. Another law that the Judiciary Committee on both House and Senate looked at was a law from the last century about decriminalizing marijuana use. And you did a lot of good work on that, too.
This is the third time in 10 years that I introduced it. Actually, I don't know if I was even a co-sponsor this year because it seemed that it was always kind of left-wing people that introduced it. And this year, a libertarian from the Northeast Kingdom wanted to be the sponsor of it. So that was, I was happy to let him do that. But we did, and the governor is going to sign it. I'm not sure, he hasn't set up a date yet, but he has supported the bill all along, so I'm sure he'll sign it. And just everybody needs to understand this is not legalizing anything. This is decriminal. It's still contraband. It's still an illegal substance. And I know that there is controversy around that some people feel it didn't go far enough, but it is still illegal, but the penalty for it is a civil penalty. Speeding on the highway is illegal, but it's a civil penalty. It's not a criminal penalty. And so for adults, it is a civil penalty with a fine. That's it. And it progresses. The second offense and the third offense are slightly higher fines, and then anything after that is at that third level. For under 21, it does something which I think we should have looked at a long time ago. The way possession of malt beverage works for under 21 is we have 14 different systems because we have 14 different elected state's attorneys, and we don't have any state law that says when it's going to be criminal and when it's not going to be criminal for under 21. So this takes both marijuana possession and possession of malt beverage and treats them the same for people under 21. And it is a civil offense for the first and second offenses and becomes criminal at the third offense. And you have to go through diversion. There's a whole process set up. But I think it's a good thing, for both of them, that we've done that.
There were some people who work with youth and prevention programs who were concerned that this makes it easier for kids. I don't believe I think it actually makes it harder, and there are consequences. What it doesn't do is it doesn't follow somebody the rest of their life.
Well, it doesn't make them a criminal.
Right.
And the problem is with criminal offenses, for the collateral consequences are so heavy for possession of marijuana. Student loans, public housing. In some states, you lose your right to vote. You can't, in many states, you can't get a barber's license. You can't be a septic tank cleaner. I mean, there are tons of professions that you're not allowed to. Going into the military, there are certain positions that you couldn't do in the military. So the collateral consequences are so intense. So making it a non-criminal offense makes a lot of sense.
Yeah. Something else that came out of the Ag Committees I just wanted to mention briefly, because it's heading to the Senate next year, is labeling GMO food.
Right.
The Ag Committee under Carolyn Partridge did a lot of good work on this year. We're very concerned, though, that this is going to be a lawsuit waiting to happen, so they did their due diligence to make sure we have a defensible law. The hope is that we'll get other states, like Connecticut, which just passed something similar. How do you see this in the Senate? Do you think it'll pass?
Well, I think I'm pretty sure it will. You know, the Senate, I had introduced over the past years 3 different GMO bills, and 2 of them actually passed the Senate and got held up in the House, and 1 passed both the House and the Senate and got held up in a conference committee. And so I think the Senate is right there with that issue. And the issue is not whether there will be a lawsuit, but whether you have a defensible law, because the problem with losing a lawsuit like that is that you might have to pay the attorney's fees for the other side, and that's when it starts to get expensive.
That concern was raised in House debate on this and a number of issues where we were accused of trying to spend taxpayers' monies just on lawyers.
Oh yeah, you did that on campaign finance.
The reality is, though, we've won some cases too.
Oh, the Attorney General's office, aside from the tobacco settlement money, brings in about $30 million a year.
Right. So I think it's a kind of short-sighted viewpoint to suggest that we only lose cases when actually we win many more cases than are lost, but some of the opponents have been focusing on that.
Right.
I think I remember when we passed civil unions, people said people would run away from Vermont. It would ruin the tourist industry, where it was actually a boon for the tourist industry. Similarly with mercury, when we took that step to ban mercury in the environment, to control it, we were told we wouldn't be able to buy a light bulb in Vermont. Well, it didn't happen. And the reality is, I think a lot of people around the country are watching what we do, because a lot of people are concerned what's in their food. The research just isn't there. The research that's there right now seems to have all been commissioned by the companies themselves that are producing GMOs.
Because no one else has the money to do the do the research projects.
The hope is that more information will be forthcoming, and this will help spur that along. There was some good news for people who were affected by Hurricane Irene in terms of losing their jobs, businesses that
well, the people that lost their jobs weren't affected by this, but what happened is that if a business went out of business or had to close down for a period of time, it meant they had to lay off, in many cases they had to lay off their employees. When you lay off an employee, your unemployment compensation rates go way up. So, but it wasn't through any fault of their own. So what we did is, for any company that had to lay people off because of the hurricane, 8 weeks of that layoff did not count toward their unemployment insurance rates. And that's a big deal for a lot of businesses in our area and Washington County and Bennington, Rutland. So it was a good thing. Future ones will only have 4 weeks of that leeway, but we'll see how that works. But for Irene, it was 8 weeks.
With the economy, with the evolving economy into a 21st century economy, Vermont is trying to help new businesses and startups. One of the things we realize that's already happening out there, intellectual properties are important in our creative economy. We did something this year that I think was the first state in the nation, and it's around what they call trolling.
Patent trolling, but it isn't just for intellectual properties here. This is for anything.
Okay.
You could invent a new toothbrush, and there are these companies. I think a suit has been filed against the first company in Vermont that's done this, or that's done it in Vermont. It's not a Vermont company, but they go out and they troll for patents, and then they send the company a letter, and they say, you know, you, by inventing this toothbrush and applying for a patent, you have violated patent number blah, 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 blah. And there's no basis in what they're doing at all. and you're going to be fined. It's going to cost you $200,000 to defend yourself, da 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 da. We'll settle for $50,000. And some companies are saying, whoa, I better settle because I can't afford to fight this. So companies are settling. It's a huge scam out there. And we became the first state to pass.
So it's happening all over the country.
It's happening all over the country. And I don't even know if these companies are based in the United States or I don't know at all. But so what this would do is make it a crime, so that there's both some monetary penalties and even perhaps some prison time penalties for doing this. And it's pretty exciting. Businesses are very excited about this because we have a lot of entrepreneurs and inventors in Vermont, and they're being targeted.
Yeah.
So this is very exciting. This came from the AG's office and a lot of patent attorneys.
Yeah.
So.
Well, I think the feedback we've gotten so far is that these businesses are excited that we're taking leadership, and that other states are watching and should follow suit.
Right.
It's one of those instances where we would have hoped Washington, D.C. could have done something, but we can't wait for Washington.
They can't do anything.
Well,
what do you mean?
It certainly seems that way sometimes.
I'm not sure they can get it together to do anything.
Well, it's
in our little 4 months,
Yeah.
I don't know if you know this or not, but some people will say this was too many things that we did, and we did too much harm, but we passed 100 bills during this session.
Yep.
And some of them were really tiny things, like this patent trolling is never going to get any glitzy.
Yep.
Some of them are really tiny things, like
charter changes.
Or separating the farms who have anaerobic digesters.
Yep.
Have been under the jurisdiction of the Public Service Board. Public Service Board doesn't know anything about producing and handling manure, but they've been doing that. So that's been separated now, and so they are only regulating the actual production of the electricity from the methane and the Agency of Agriculture. So some of those are really little bills that have a huge impact on some people, but aren't glitzy and will never get publicity.
Yeah.
So, and there's a lot of those.
Yep. Most people follow one or two issues through the course of it. And there's 25 different committees in the legislature between the House and Senate, and a lot of it are nuts and bolts kitchen table issues that people don't pay attention to until it starts to affect their lives, like with unemployment payments.
Or anaerobic digesters, which affected a farm right here in our very county.
Right, Westminster Farms has. And we're trying to encourage more, because Westminster Farms now not only produces the electricity for the farm, but I think about 100 other
I think it's about 150
houses. And plus, it produces their hot water, and end product is it produces bedding, which is getting more and more expensive for farms. So it's win-win, and we want to try and promote more of these. So I think there's some good things happening in Vermont that not everybody pays attention to, but these are small things that all add up to why Vermont's a good place to be.
And as much as some people think the legislature should only be focusing on one thing while we're up there, like the economy or whatever, as you said, there are 25 committees, and each committee probably has. Well, our committee passed, I think, 24 bills.
Yeah. Is this GovOps?
GovOps. I mean, a lot of them were charter changes, and they're not very big. But we can focus on more than one thing at a time.
And sometimes for a town, a charter change is a very important thing.
Oh, yeah.
And right here in Brattleboro, they've undergone a charter change, and maybe looking again at some changes in the future.
Well, Little Woodford in Bennington, for the first time, decided they were going to take matters into their own hands, and they came up with a charter. They have,
how many people?
I think it's about 500. It's not very many, but they did it.
So government operations also passed a search and rescue bill.
We did.
You want to say something a little bit about?
Well,
it was a tragedy that inspired this. But
it was a young man in Ripton that was missing and was reported missing. He was an experienced hiker. It was in the wintertime. And unfortunately, what had happened is he'd fallen and broken his leg, and he froze to death overnight. And it wasn't anybody's fault, but it became very clear that we didn't have procedures in place for how to deal with a search and rescue. We have missing persons, and we have very clear guidelines for that. Search and rescue is when you have somebody who's missing and it's defined as the backwoods or the waters of the state. So it's a capable person who's just become lost or incapacitated. And so this bill sets up a procedure for that involves local EMS people, local fire departments, police departments, the state police, the state emergency systems, and it's very clear the protocol is all there.
Yeah.
And it should avoid any kind of a repeat of that unfortunate incident.
Yep. Well, now there were some other pieces on government operations that
didn't make it.
That didn't happen, but
Right.
we're hoping they can still move ahead next year.
Like campaign finance,
Yep.
which is one of my priorities, and through a kind of a convoluted process, it didn't happen, and it got to the House late. It got out of our committee on time, but then it didn't get off the floor in a timely manner, so it got to the House kind of late. The House got it to us just a couple days before the end of the session. There were issues in there that we couldn't concur with. And so we set up a conference committee, and there just wasn't time for the conference committee to...
But it's now an open conference committee?
It is an open conference committee.
And just to explain a little bit, since we're a part-time citizen legislature, the session is spread out over 2 years,
Right.
a biennium. A bill can start in 1 year and then be continued in the next year, but at the end of the biennium, then they have to start from scratch. So in this instance, because it's such a complex bill, I think we're trying to take our time because we're probably going to be looking at another lawsuit over this.
We will have a lawsuit over it. It's whether or not we can defend the law that we come up with. And to be honest, there were some things in the House bill that will not pass the Senate. They won't. And so we have to come up with some kind of a compromise that will pass both the House and the Senate. Because, and there were some things in the Senate bill that clearly didn't pass the House. So we're going to have to figure out.
And that's why we took our time and extended the conference committee.
Right.
There are other bills that have gotten such treatment as well.
I think there is one other open conference. I think there's just one other open conference committee, and it's a very simple bill, but at the very last minute it ran into some trouble. It's around closing off water for tenants in buildings. So that's also an open conference committee.
Another issue that was important to a lot of people, got a little bit of notion, was equal pay for women. Now, we've had laws on the books, but the reality is that men make $1 for $1, and for similar jobs, women, I think, make, is it 70 cents?
I think it's about 70 cents.
A lot of us feel it's time to take action on that. It's time to put our money where our mouth is, to put our money where our votes are, and equal pay means equal pay.
And this really doesn't say there has to be equal pay, but there are some prohibitions around how you find out if your pay is, like if we're working for the same person, I'm not allowed to ask you what you're paid. That seems ridiculous, but so this says that you can't prohibit employees comparing salaries, and it redefined the use of sex for unequal pay. I mean, how that's defined. It also says that the state will try to make sure that its contractors have equal pay for equal jobs. So when we contract with somebody, I mean, it doesn't guarantee it, but it's a step in the right direction.
And I think what it does, it sets a tone. It sets a tone to say, this is what we believe. We're hoping that actions will follow.
Yeah.
It took a long time after the passage of the 1964 Civil Rights Bill for things to change to where we have an African-American president, but there's still things that need to change in this. Equal pay is still on the horizon, but we want to move things there.
Right.
Another bill that might not affect a lot of people, but for some people it's very important, is around suspended driving privileges. You want to just explain a little bit what the reality is for a lot of people in Vermont, though?
You know, I can't remember the statistics now, but it's something like 26,000 individuals who are driving with suspended licenses. It's a huge number. And about 95% of them are not because of criminal activity. I mean, when you see in the paper somebody was driving with a suspended license, or this is their third suspended license arrest, your mind, or my mind anyway, tended to jump to, whoa, they've been driving drunk or whatever a lot. It isn't. Only about 5% of them are related at all to that. So you're driving down the street and you are speeding, which isn't a good thing to do, and you get this humongous fine, and you can't pay it because you just lost your job. And so you don't pay the fine, and then your license is suspended. Now you have the fine, and you have the reinstatement fee to reinstate your license. You can't pay that, so you drive. So you get caught.
Because you have to go to work.
Right, now you get another job. So it keeps adding up, and pretty soon the penalties and the fines are way up there, and we're never going to see that money. People aren't going to do it. They need their cars to get to work. So what we did is, I suppose it's kind of like an amnesty program. If you apply to do this, you go to diversion and you sign a contract. You figure out, okay, my fine is $2,000. I'll never be able to pay $2,000. I can't. I make minimum wage. I have 3 kids. I can't do it. So you make a deal. You say, I can pay $700. I can pay this much over this many months. You sign a contract. You get your license back immediately. As long as you keep up with that contract and abide by the terms of it, you've got your license. Once you fail to abide by the terms of the contract, then you lose your license again. Yeah. But for those people who need to have their cars and need to be able to drive to work, it's a great program.
Yeah.
And
well, I think it reflects the reality for a lot of people and how dependent we are for vehicles, especially to get to work or to get anywhere right now.
Right, and it's just, we're never going to see that money in the state anyway. It's money that people cannot pay. And I know that there were some people who were saying, well, driving is a privilege, it's not a right, and we shouldn't be coddling them and doing this. The reality is that there are all those people out there in that situation, and eventually, when you get to your 5th one, your 6th one becomes criminal. Yeah. So now it's a criminal offense, and we don't want that. So invitations were sent out to people to participate in it, and they started at the people who were on their 5th, so that their next one would become criminal. And they're working down from there and working really closely with the Judicial Bureau and the courts and diversion programs around the state. I think it's an exciting program.
Yeah. One of the bills that we passed that did get a lot of attention, especially locally, because I heard about the patient choice at the end of life bill from a lot of people in this area. Again, I think this is a reflection of life in the 21st century, the realities that technology, medical technology, can almost keep us alive indefinitely.
Right.
So these questions come up about quality of life. Some of the good things that came out of it were an increased emphasis on advanced directives, palliative care, hospice services. But the reality is that for some people, they want that choice. Now, I'm somebody who's pro-choice. I don't believe government belongs in our bedrooms, our hospital rooms, our hospice rooms, that this is an individual choice that people should have in limited situations. And I think we passed a bill that, at least initially, will provide the same kind of protections that the Oregon bill does. But it was a long time to get there, and I know you worked hard on it.
I did.
Your roommate, Senator Claire Ayer, I think deserves a medal for how she worked hard to keep this bill going.
And really, I think, acted as a guiding light for us, that she was just on top of everything. I mean, when it came out of the Health and Welfare Committee, I think it was a really, really good bill. And at the last moment on the Senate floor, there was an amendment that struck the entire thing. And I know people will be stunned to hear that you can take weeks of testimony, and then somebody can offer an amendment that strikes the entire bill and offers an amendment that was just written right then. And what that amendment did, in fact, was got rid of all the safeguards, and it did what some people said was keep government out of your dying and left it as a decision between you and the physician. But in fact, what many physicians and the Attorney General said is really it was a license to kill, because all it did was there were no safeguards, and if you were terminally ill and the doctor gave you a prescription and you overdosed on it, there was no liability. You didn't have to have the intention of overdosing. You might have overdosed and not died because you didn't know how much you were supposed to take. So, but it did. It went to the House then, and the House worked on it and came back with a much better bill again that was more similar to the bill that we originally had that came out of committee. And in the end, there was a kind of a compromise settled that, like you said, for the first 3 years, it has all the safeguards and stuff. And at the end of 3 years, that will sunset, and it just becomes an immunity bill for...
We'll see what happens in 3 years.
Well, we can extend the sunset. We can... And one of the feelings is that we don't have any laws right now about if I decide to deactivate my heart, whatever it is, I'm going to die, right? We don't have any laws that regulate that, and we don't have any laws that regulate how I decide to forego food or water. And they've become part of good medical practices. And so this will eventually become part of a medical practice, and really what we need is then, and a physician is going to take those safeguards, because they're not going to open themselves up to this kind of, to any kind of family dispute or anything. And we need the reporting so that we know what's happening. But I think that it was a hard-fought bill. It was... there were a lot of people who were philosophically and morally opposed to it, and I respect their position. I think that what this does is it doesn't take any rights away from anybody, and it gives rights to some people. So for me, it wasn't a moral dilemma, because you didn't have to do anything you didn't want to do.
I know one of the things that was compelling for us in House Human Services, and I want to thank Representative Ann Pugh for some great leadership, and the way she worked with Claire Ayer.
Yeah, they worked very well together.
And just as a little background, Senator Ayer is a nurse, Representative Pugh is a social worker. So this is an issue.
And Senator Ayer is married to a doctor.
And she's married to a doctor. This is an issue they know right down to the ground level. So we took a lot of testimony on this. I think we got to a place where we recognized in a limited way this would work. Somebody locally I want to acknowledge, and Ben Underhill came up for a lot of the debate. He offered some compelling testimony about his own situation. Anybody who knows Ben has watched a valiant fight that he's put up with multiple myeloma, a blood cancer. Anyone who's known Ben for a while knows what a avid athlete he'd been over the years, what a great Red Sox fan he is, and how difficult it must be now as he's now confined to a wheelchair, but his spirit is as strong as ever. And he gave some compelling testimony
He did.
about why somebody like him, who's been fighting hard, who is a fighter, but can see the possibility at some point that that he would want this choice. And again, it comes down to choice for me, and that's why I voted for the bill. And I think people should have that choice. There's a lot of areas where I'm pro-choice, and this is one of them.
Yeah, I agree. And the governor signed it last Monday or last week anyway.
Yeah.
So it's in effect now.
So now it's in effect, and as with any law, now the process of reality comes in. How is it affected in people's lives? And that'll take a while. Hospitals are trying to figure out how to deal with this, individual doctors who hadn't thought of it. I should remind people, it doesn't force a doctor or any healthcare professional
to do anything.
I had a question from someone who was a nurse, and they said they weren't sure about this, and I said, well, you don't have to be.
Right.
You don't have to participate.
Right.
That's not the way it works in Oregon or Washington or
and
any
it
of the
isn't
states.
the way it works under this law.
That's right.
It's nobody's forced to do anything they don't want to do.
Yeah. Are there any other bills that you'd like to put out there that people might not have been following?
We talked about a lot of them. There are a lot of, well, one of the bills that we didn't talk about that you thought we should maybe was the, I don't even know if it had a name, the opioid bill.
That's
but
right.
One of the things that we did in
treatment.
there, well, it improved treatment, and it also, and I know that for a while there was some controversy about this was just too much, but Vermont got ahead of the war on methamphetamine production because we very early on required I don't even know what their names is, their ephedrins something,
Right.
to be behind the counter.
Yep.
And now there's going to be even stricter regulations on those as part of that bill, that you're going to have to not have a prescription, but show an identification when you come in, and you're only allowed to buy so much. And some of it is federal law, and some of it is our own law.
And it will also strengthen the prescription monitoring system.
Right, exactly.
And one of the problems we're seeing in Vermont, a lot of the drugs, the addictive opioid drugs, are obtained legally initially, and then they're diverted. We are not focusing on any one part of that situation, but all of those pieces of the system will do well to look at how they're working, how they can work in the future. It's not just a law enforcement problem.
Right.
It's not just a medical problem. It's a systemic problem that we want to take a look at. But the fact is, one Vermonter a week now is dying from a prescription overdose. And that's not okay. It's not the trend we want to take going forward. And we felt we needed to act.
Well, and what we heard was that it isn't just the diverted prescription drugs that are causing the problem, because what happens is they get very expensive. So somebody gets addicted to them, and then it's very expensive. And heroin is a lot cheaper. And the price of heroin has gone down because we have all these people now who are addicted to prescription drugs, and they can't get them because they're too expensive. So the heroin epidemic is now growing in Vermont as a result of that. And we were told that 3 years ago when this guy came up from New Jersey who works on drugs there, and he said that whenever you have a high amount of diversion of prescription drugs, you're going to see an increase in your heroin use because it just is too expensive to keep on.
And it's all over the state now. It's all over the country. People are seeing headlines locally now and saying what's happening. Well, it's been happening for a while, which is why we did something this year in the legislature to address systemically where the drugs are coming from, prescribing trends, diversion, and tying law enforcement into it. It's a complex problem, and it takes a comprehensive solution, and I think we started our way onto that.
And the treatment, we need to beef up the treatment, because
Yeah.
if somebody went into a treatment facility right now today and said, I have a heroin addiction and I need treatment, it would probably be an 18-month wait.
Right.
Well, in those 18
That's a
months,
problem.
yeah.
And we are looking at that as
Yeah.
well. We need to make more treatment beds available.
Yep.
We need more outpatient treatment. I know what's happening here locally at the retreat. They're doing some good work, but we need more like that all across the state.
And there is some a study in there, I believe, that would ask for a waiver so that we have some buprenorphine clinics, but they're very limited, and they too have a high demand. And there are some doctors who could probably be connected to a clinic, but practice out of their office. So we're looking at the possibility of that. That's part of that bill.
We've only got a few minutes left.
Oh, yes.
And what I'd like to do is, we haven't talked about health reform yet.
Yep.
And there's going to be a big development in Vermont. We've been working hard for years now to lay the foundation for a new healthcare system. We're moving towards a single payer. And the next step, so we will stay aligned with federal laws, and that's primarily so we maintain our Medicare and Medicaid funding, is a health exchange, an online way to purchase health care, health insurance, I should say. And that's going to start in October. There's a web portal that has been developed. We've seen it in the legislature. It actually looks very impressive. It seems to work well. They've been working hard to make sure that there aren't bugs when they're ready to unveil it. And I should say that there's going to be some information sessions around the state. We're going to be hosting one in Putney at the fire station on June 13th at 6:30. So we invite people to come out and hear and see. We'll have somebody from Green Mountain Healthcare Board. I think it might be Mark Larson who's going to come. But there will be somebody from the entity that we've created to move us towards single payer there, who will be there to explain this next step and to show what that web portal will be, and introduce the system for people who can't access it. And what we've done is put money in for what we call navigators. Those navigators will help the elderly, those who don't have computers, who don't
Those
have...
are who technologically challenged like me.
That's right. So we're making accommodations for a lot of different people. And so that's going to be June 13th at the Putney Firehouse at 6:30.
And I'm sure there will be others around.
That's right. They're going to be all around the state. All legislators were offered this opportunity to bring these, so we signed up to get one in Putney. There may be some in other parts of the county later on, but this will be the next one in the series. One more thing I want to point out that we didn't do something about this year, but I hope we do next year. A lot of us are concerned about public safety and the reality that there are people out there who can get guns who shouldn't. Convicted felons, people who have histories of violence, mental illness. Vermont is a very safe state, and we want to keep it that way, but unfortunately, the Newtown shootings all around the country are making us realize this is a new time. These are laws we need to update up into the 21st century. And there's going to be a gathering June 15th on the Brattleboro Common at 7 p.m. There's going to be a memorial service, a commemoration for the people at Newtown, and support for those of us who would like to see the legislature take a step next year around background checks, who would like to put public safety in a different light. We're not looking to take anyone's guns away, but we are looking to start a dialogue on how to move forward. So I welcome people.
Yep.
That'll be June 15th at the Brattleboro Common. Jeanette, thanks a lot. It's been great working with you again.
One more year under the belt.
Look forward to next session in January.
Yeah, it'll be, we'll finish up a lot, and there'll probably be new issues coming up to face us. And Thanks
also to the people here at BCTV. They're doing a great job. They're working hard to continue to upgrade their service to you and to help bring the legislature and the work that we do closer to home here. So we appreciate all the people here at BCTV and the work that they do. That's it for another edition of Montpelier Connection. Thanks, Jeanette.
Thank you, Mike.
And thanks to you at home. Bye-bye now.
Bye.
Thank you.